Hello, my name is Gabriella Ward, and today, throughout this finance and reimbursement presentation, I will be covering the different aspects of Medicare. Throughout this presentation, I will cover my introduction and thesis statement. Then I will give a brief history on medical insurance in the U.S. Then I will move on to cover Medicare system components. Then I will do the main issues and potential solutions. And lastly, I will give an application and conclusion in relationship to healthcare administration. The main issues: Medicare health coverage reimbursement schedules involving delays, improvements to functionality, expansion of Medicare, rising costs, and limited flexibility for physicians. Medicare, a significant source of healthcare insurance for millions of Americans, faces financial reimbursement challenges due to rising healthcare costs, economic and demographic shifts, evolving healthcare priorities, and the intricacies of medical billing and reimbursement, necessitating continual structure improvements for sustained effectiveness and viability. The establishment of Medicare began in July 1965 under the Lyndon B. Johnson administration, resulting in a rise in health service utilization and alleviated the financial strain on the elderly population facing costly medical bills. Moving on to the chosen system of care and rationale. Major system components. The U.S. federal government provides Medicare as a health insurance program to individuals aged 65 years and older, individuals with disabilities, and individuals with end-stage renal disease. Medicare is also comprised of 4 parts, Parts A, B, C, and D, and each provide different coverage plans for health services and pharmaceuticals. Medicare reimburses healthcare providers for their services, utilizes specific billing codes, and is based on a fee-for-service schedule. Main system responsibilities include provide health coverage to individuals with assistance at a reduced cost to support affordability. Original Medicare Part A and B is used to cover hospital insurance and outpatient services, while Medicare Advantage additionally covers vision care, dental care, and prescription drugs. Medicare Advantage comes with an additional cost, and patients may be subject to only visit certain providers within network. And lastly, a major responsibility is improving access and the affordability of care. Continuing on with main system responsibilities, Medicare is financed by the taxes that individuals pay during their working years. Medicare employs both diagnosis-related groups, DRGs, and relative value units, RVUs, to establish reimbursement rates for the services offered to patients. Healthcare providers submit billing information and medical claims to Medicare for reimbursement through EHR systems, which is then reviewed and approved by Medicare admins. According to the system's effect on healthcare delivery, it is important to note that there would not be adequate health insurance coverage for the elderly population in the United States without the use of a Medicare program. Continuing on with the main issues and potential solutions. The first main issue involves healthcare reimbursement adequacy and schedules. To improve delays and inconsistencies associated with Medicare reimbursements, one must ensure that there is accurate coding and documentation into the MS-DRG category by using the correct ICD-10 code associated with the patient's personal information and diagnosis. Medicare reimbursements may not always fully compensate physicians for their services due to the fee-for-service structure that is set in place each year by Medicare, leading to a gap in expenses. This can be difficult for healthcare providers to ensure quality care while it affects investment and financial stability. Lastly, the use of inaccurate medical billing codes due to undercoding or upcoding will impact the reimbursement rate and schedule delays if not properly submitted to Medicare officials, as it will be sent back for revision. In conclusion, it is important to ensure accurate coding and documentation through MS-DRG and ICD-10 codes. Medicare utilizes a fee-for-service payment schedule, and lastly, provide accurate documentation of services provided to help prevent undercoding. To briefly touch on the Medicare billing and coding accuracy or reimbursement, the Centers for Medicare and Medicaid Services utilizes the system to group patients based on similar diagnosis, patient information, and other common factors. Medicare MSDRG components indicate the diagnosis and enable standardized and predictable reimbursement rates. Medicare ICD-10 indicates the procedures performed. MSDRG stands for Medicare Severity Diagnosis Related Groups, while ICD-10 indicates the International Classification of Disease 10th Revision. Healthcare admin should ensure financial integrity, overseeing operations, and optimizing patient care. Lastly, it is important to note that issues may arise with code specificity depending on the complexity of the patient's condition. Continuing on with the second main issue revolving around sustainability with rising costs in healthcare. Due to the aging population and longer life expectancy, there is an increasing enrollment of beneficiaries into Medicare each year. There are issues with Medicare hospital insurance funding and solvency, and hospitalization, nursing home care, hospice care, and certain home health services, medical expenses are subject to impactful changes. Alternatives to this issue would include shifting to a value-based care model, and cost containment measurements by reducing unnecessary medical interventions, optimizing funding, and measuring utilization of services. Important changes and challenges related to finance and reimbursement. Medicare is consistently influenced by economic conditions, inflation, and geographical locations, resulting in payment fluctuations. And the revenue for healthcare providers is subject to change, which may impact their services offered. Additionally, Horvat 2023 asserts that discussions surrounding healthcare reimbursement arrangements or strategies may remain a prominent topic within the healthcare sector, with organizations consistently seeking ways to enhance the important revenue cycle management process. Continuing on with influencing factors, due to financial factors, healthcare providers running their practice, medical facility, or institutions are compelled to reduce certain services and increase out-of-pocket expenses. According to Takesha Rowland Jenkins, she emphasizes the crucial role that reimbursements play for medical providers and institutions. She asserts that despite the significance of these payments for expenses that are covered, physicians encounter several obstacles when it comes to receiving reimbursements. These challenges include unpredictable reimbursement schedules, audits on conducted payments, errors in billing codes, denials, and appeals. Lastly, it is important that healthcare providers remain up to date on new or updated Medicare policies, respond efficiently to new healthcare innovations, and use their incentives as a way to improve quality measurements. Continuing on with an application and conclusion in relation to healthcare administration. A quick overview, I will cover the system strengths and challenges, finance and reimbursement strategies, potential alternatives to consider, and the significance to healthcare finance and reimbursement. The system strengths include budgets and financial evaluations, adherence to guidelines and policies for accuracy and confidentiality, effective communication by healthcare providers with patients, ensuring entitlement to specific services and comprehensions of benefits. Lastly, correct and timely completion of Medicare billing and coding to avoid reimbursement delays. Challenges: obtaining reimbursements payments is vital for a physician's practice or large healthcare organization to sustain their practice and ensure proper compensation. Healthcare providers may encounter delays in receiving reimbursement for services when patient information changes, as accuracy is crucial for insurance companies to process payments efficiently. And lastly, fluctuation in expenses due to economic forces and inflation may increase the need to reallocate certain services. Finance and reimbursement strategies should include tracking coding methods, analyzing performance, utilizing EMR systems, conducting data checks, and managing the quality of healthcare delivery and improvements. Potential alternatives to consider include adopting a value-based care system in order to enhance quality of care and improve patient outcomes, increase healthcare incentives, and improve financial stability and support population health. Significance to healthcare and finance. A shift towards a value-based care model has the potential to serve as a metric and indication of patient satisfaction, judge care performance, and regulate the overutilization or underutilization of services. Lastly, in conclusion, here are my recommendations and continual learning aspects. In understanding healthcare finance and reimbursement, understanding Medicare fundamentals, policies, revenue cycles, and compliance can help navigate this complex system of care. The factors discussed interact with and shape Medicare financing reimbursement to ensure financial sustainability, monitoring functionality, billing and coding, and improving quality of care. Here is the list of the resources I utilized throughout this presentation. And lastly, I would like to say thank you for listening to what I had to say about Medicare finance and reimbursement, and I hope you have a great rest of your day.